So hi, I'm Natalie McNeely. I'm a third year vet student here at Mississippi State. I'm originally from Tampa, Florida, and my post-graduation area of interest is small animal and exotic emergency medicine. So today we're chatting with Dr. Christie Chavez. She's one of our ER clinicians here at State. Thank you for agreeing to do this, Dr. Chavez. How are you?
I'm good.
Good, glad to hear it. I guess to get the ball rolling, if you wouldn't mind just telling us a little bit about yourself, where you're from, where'd you go to school, that kind of thing.
Okay. So yeah, I was originally born in Denver, Colorado. Moved to the great state of Mississippi when I was about 9 or 10. Um, spent most of my life in North Mississippi. Went to undergrad at Mississippi State. Started vet school here in Mississippi State and graduated from the great Mississippi State College of Veterinary Medicine in 2007. I left Mississippi State and went to private practice in North Mississippi at a 24/7 general practice, overnight medicine, emergency medicine clinic. I was there for 12 years, and then I came back here at Mississippi State to teach emergency medicine here back on March 1st. So now I'm here.
We made a full circle. We roped you back in.
I roped me back in. Found my way back home.
How did you get started in emergency medicine? Like, what sparked your interest, and how did you get going in it?
Okay, so I started out my veterinary career doing the required hours for vet school. I actually found a clinic right around the corner from my house at the time called like Animal Hospital. So I started out there with a great mentor named Dr. Christie Chavez, and he gave me this fine job as a kennel technician. So, cleaning cages and doing some mild restraint, those kinds of things. Kind of worked my way up through that to become just a daytime technician. And then about 4 years into me being there, right as I started freshman year of vet school, he actually bought the emergency center down the street and moved it to his clinic. So then because your hours are so weird in vet school and you only get to work on breaks, I actually ended up being an emergency technician at that clinic. So I worked like holidays and did nights and things as it worked into where I was, not in school. And really found that I really enjoyed the emergency medicine aspect of things. Really liked the adrenaline rush and really liked the never knowing what was going to happen and having to make split-second decisions and those kinds of things. And so just really found my niche in emergency medicine by being that technician at that time.
Awesome. So I imagine it's a little bit different here at the referral center as opposed to a private practice, but if you could kind of touch on what an average shift looks like for you here in the ER and how it might compare.
Yeah, so what's interesting here is when I got here, they weren't doing any daytime emergencies at all. So the different services were taking their own emergencies and kind of fit them in and getting things done when they could get done. So one of the things that they talked to me about when I took this position was to try and start a daytime emergency type, I guess, referral service. And we also still have the nighttime emergency service that we've always had. So during the day, we take some emergencies as far as like we've seen some traumas, we've seen some things like that. So a good bit of what we see during the day is more like taking in referral cases that are either they don't feel like are stable enough to make it to their next appointment, or just honestly, it's probably somewhat of a convenience thing sometimes. But we take in those cases, we work them up to the best of our ability for that first day, make sure they're stable, get them started on treatments if they need treatments, fluids and things, get them set in ICU, and then generally transfer them to the other services that they're supposed to transfer to the next day. Nighttime emergency is a little bit more like an actual emergency center because we see actual emergencies. So, for example, last night we saw pretty decent laceration that we repaired and sent home. We saw a dog that was kind of stumbly, kind of looked like it might have got into something. And those are generally there's an emergency clinician on most of the nights during the week. And then there's interns that kind of call and get advice for the rest of the time there. The way I like to do the emergency service here is just for the students to kind of basically like an intern. So if we don't have an intern on, or even if we have an intern on, the goal is to bring that case in, do our triage, evaluate that patient, and then make a decision like where do we go from here? What do we need to do next? And kind of talk through it. And then once we make those decisions, we just make them happen.
Right. One of the, like you said, with the students on the clinic, one of the awesome things about State is we have those 2 years of clinical rotations, and that allows for a lot of contact time and hands-on experience. What do you like about working with the students in the clinic
Yeah, so I kind of got my start with students. I started an externship program at Horn Lake once I had the opportunity to do so, and kind of just found a niche that I really like to kind of just share knowledge, make decisions, and really just see that spark in people. So I really enjoy that aspect of it. I really enjoy the aspect of bringing emergency medicine to Mississippi State, trying to make it a little more realistic, a little bit more like real life. You know, you have to make these decisions and help them make those decisions, do those kinds of things. Because I feel like if you get your feet under you now, then you'll have them still when you get out. So that's my main goal. One of the things I like to tell students is my goal is to leave you better than I found you. And so not everybody's going to come into my service and be at the same level. Not everybody's going to come into my service and have the same goals. The point is to be at a higher level when you leave, and to hopefully accomplish some of those goals that you've set when we start.
Yeah, sounds good. I'm excited to come and have my shifts with you.
Natalie?
Not that I have any personal interest, but what advice would you give to current or prospective vet students who want to go into ER, critical care, and those kinds of things?
So what I always tell students when I do orientation is I understand that not everybody wants to do emergency. It's not for everybody. But I do personally feel like I think that just doing a little bit of emergency medicine here and there, or just going through the rotation, the goal is for you to get some skills that are going to help you. It doesn't matter what aspect of veterinary medicine you want to go into. If you want to do emergency, or you want to do GP, or those kinds of things, you still need the skills of being able to manage a team, because veterinary medicine is a team. You can't do it by yourself. I can't run ICU without my technicians. I can't do ICU without the students there to help me. So the biggest aspect of emergency medicine I think people get is you're part of a team. And I think everybody's equal on that team. Everybody has to play their part in that team for it to be successful. And I feel like that doesn't just have to be emergency. I feel like that's for all the aspects of emergency of veterinary medicine in general. It's just to be part of a team. And so as far as emergency medicine goes, I think it's a great thing to do, even if it's not something you want to do forever, because I feel like being in that aspect of emergency medicine gives you the ability to be able to stand on your own 2 feet, build the confidence to know that you can stand on your own 2 feet, and be able to make decisions as they need to be made. And so that's just how I feel about emergency medicine. Like I said, I don't think everyone wants to do emergency medicine, and that's fine because it's not for everyone. But I feel like you can get things out of it that help you no matter what aspect you want to go into.
Right. I agree. All right, well, that was kind of all I had for you. So unless you have anything else to add.
No, I mean, I think anybody wants to go into emergency medicine, I think it's a great experience. I think it's a great thing to do. I think you'll get really good things out of it. I mean, you meet those clients at moments when they're panicked. You have to be the calm in that storm and be that person that's there for them. So I think you get to build some pretty decent relationships, even if you only see those people one time. And so I feel like I like it. So that's why I do it. So.
Right. All right. Well, thank you so much for doing this with us today. And thank you for your input. We really appreciate it.